Welcome to the Deep Dive. We're here to really get into the essential information you need on important topics. And today we're tackling something that, well, for any horse owner, it's a bit of a hidden danger. It can lurk in something as simple as hay. We're talking about blister beetle poisoning. You might also hear it called Cantharidin toxicosis. Our mission today is simple. Unpack the critical info from the best guides out there and give you the essentials, quickly and clearly. Because it's pretty startling how a tiny insect can cause such a devastating illness, often fatal. The toxin is surprisingly potent. Okay, so let's start right there. The toxin itself, it's called Cantharidin. For owners who maybe haven't come across this term, what exactly is Cantharidin and why is it such a big deal?
Right, cantharidin, that's the specific culprit. It's a highly irritating chemical. It's actually produced by the male blister beetles. They transfer it to the females when they mate, and it ends up, well, pretty much throughout the beetle's body. But the really key thing here, and kind of fascinating, is how stable it is. It stays potent even after the beetle dies, even if it dries out, or, and this is critical, if it gets crushed into the hay during baling.
Wow. Okay, so that stability is really the problem.
Exactly. It makes it a persistent, silent threat.
So if a horse does ingest this stable toxin, what's happening inside? How does it actually cause harm?
Well, once it's ingested, cantharidin acts as a direct irritant. Think of it almost like a chemical burn on the inside. It hits the mucous membranes, first causes inflammation, blistering, even tissue death, necrosis, wherever it touches, and it gets absorbed really fast from the GI tract. Then the kidneys try to excrete it, which means it irritates the urinary system just as badly on the way out. So you get this widespread irritation, digestive and urinary. Plus, and this is really important, it seriously messes with the horse's calcium and magnesium levels, vital minerals, for muscle and nerve function.
Right, calcium and magnesium. Okay, and this is maybe the most alarming part. We're talking small insects. How much toxin does it actually take? Is it like hundreds of beetles?
Well, unfortunately, it's much, much less. The toxic dose is incredibly low. We're talking as little as 1 milligram of cantharidin per kilogram of the horse's body weight. That can be legal. And the amount of cantharidin varies between beetle species. So just a few beetles of a highly toxic type, like the striped blister beetle epicotta species, could be enough. To put a number on it, studies suggest as little as maybe 4 to 6 grams of dried beetles. A tiny handful could kill a horse.
4 to 6 grams, that's tiny.
It really is. Devastating potential from a very small amount.
That low dose is just chilling.
Yeah.
So, okay, how does this tiny amount usually get into a horse's system? Is it always the hay connection we hear about?
Yeah, you've hit it. The most common route by far is contaminated alfalfa hay. And to understand why, it helps to picture the beetles. They're sort of sock-bodied, long legs. They have this distinct narrow neck behind their head. Colors vary. Some are black or gray. Others are like yellow with black stripes. You find them across the U.S., but they're definitely more common in southern and eastern areas.
Okay, but why alfalfa hay specifically? What draws them there? Is it just random bad luck?
It's mostly about their behavior, their feeding habits, mainly. Adult beetles love flowers and leaves, and alfalfa, especially alfalfa that's flowering, is a huge draw for them. It's like a buffet. They also have this gregarious nature, meaning they like to hang out together, so you often find them in a big, dense swarms, sometimes just in one part of a field or along the edges. Oh, and interestingly, sometimes you see more blister beetles after a big grasshopper year because the beetle larvae actually eat grasshopper eggs.
Huh. Didn't know that connection. So swarms in the alfalfa. How does that lead to contaminated bales ending up, in someone's barn? What happens during harvest?
Right. This is the crucial link, the harvesting process itself, particularly when farmers use equipment like crimpers or conditioners. These machines crush the hay stems to help them dry faster. But if there's a swarm of beetles in that patch of alfalfa, the machinery just crushes them right along with the hay. They get trapped. And that crushing action is key because it releases the cantharidin. The toxin then basically soaks into the surrounding hay.
Oh, so even if you don't see the beetles.
Exactly. The hay can still be toxic. The toxin itself is invisible once it's released, and unfortunately, the timing often works against us. Later cuttings of alfalfa, second, third, maybe fourth cutting, tend to be riskier. That's because harvest time often lines up with when the beetles are most active, mating and swarming.
That makes a lot of sense, a kind of perfect storm. Okay, so knowing this, this silent, potent threat is out there. What are the warning signs? What are the red flags owners absolutely need to watch for?
That's vital. The signs usually show up pretty quickly within, say, 3 to 18 hours after the horse eats the contaminated hay. And how bad the signs are really depends on how much toxin they ingested. But there are definitely some characteristic things that should make you pick up the phone to your vet immediately.
Let's zero in on those. What are the most common, maybe the most critical signs that could help an owner realize what's going on?
Absolutely. First up, and you'll almost always see this, is GI irritation. Gastrointestinal, that usually means colic. Could be mild, could be really severe, just unrelenting pain. Often, colic is the very first thing you notice. You might also see blisters or sores inside the mouth, on the tongue, the gums. And one really memorable detail owners report is horses dunking their muzzles in water over and over again.
Trying to soothe the mouth.
Yeah, probably. Seems logical. Trying to cool that burning sensation. Other GI signs, loss of appetite, definitely. Drooling a lot. Being depressed, lethargic. And sometimes even bloody diarrhea, if it's severe.
Yeah.
Then you've got the urinary tract irritation. This might look like the horse trying to pee really often. Maybe just dribbling vets call that polyuria. Or straining hard like they can't pee, stranguria. You might see blood in the urine. That's hematuria. It's all from the inflammation caused by the toxin passing through. And this irritation can lead to serious kidney damage. You'd see that on blood tests later. And finally, maybe the most specific signs relate to the metabolic effects. The absolute hallmark finding on blood tests is profound hypocalcemia. Very, very low calcium.
That low calcium causes problems, right?
Big problems. It leads to muscle tremors. You might see twitching, especially in the face muscles or along the flank. Muscle stiffness, too, almost like tying up signs. And the classic, almost textbook sign is something called synchronous diaphragmatic flutter. Everyone just calls it thumps.
Thumps? I've heard of that.
Yeah, it's where the diaphragm muscle starts contracting in sync with the heartbeat. It looks like hiccups in the flank area. It's a direct result of that severe electrolyte imbalance, particularly the low calcium affecting the nerve that controls the diaphragm. You'll also typically see low magnesium, dehydration, fever, fast heart rate, fast breathing. And in really bad cases, shock, or even sudden death before you see many other signs. Other things, restlessness, sweating, gums might look dark red or muddy, slow capillary refill. Some horses even get aggressive or have seizures right before the end. It's a grim picture.
Wow, that's a really tough set of symptoms. Some distinctive, but some overlap with other things, like severe colic. So if an owner sees these signs, calls the vet, how does the vet confirm it is blister beetle poisoning?
Good question. It's definitely a puzzle, putting the pieces together. First, the history is absolutely key. Has the horse eaten alfalfa hay recently? Especially alfalfa from a region known for blister beetles, or maybe a later cutting. That's a huge red flag right there. Then, the clinical signs themselves. That combination of severe colic, the mouth sores, the urinary signs, and especially if you see muscle tremors or thumps alongside low calcium, that picture becomes highly suggestive. Lab findings are critical support. Blood work showing that profound hypercalcemia, and often hypomagnesemia too, those are major clues. You might also see markers for kidney stress, dehydration, high blood sugar, maybe elevated muscle enzymes. There's muscle damage. Urinalysis can also help. Sometimes the urine-specific gravity is low, even if the horse is dehydrated, which points towards kidney issues. And finding blood or muscle proteins in the urine adds to the picture. But the absolute definitive diagnosis comes from finding the toxin. Now, finding the actual beetles, whole or crushed, in the hay or the horse's feet, well, that's definitive, obviously. But it can be like finding a needle in a haystack, literally.
Right, especially if they're crushed and the toxin has spread.
Exactly. So the gold standard is chemical analysis to detect cantharidin itself. And for testing, urine is often the best sample, about 500 milliliter. Because the toxin is cleared pretty quickly through the kidneys unchanged, you can also test stomach contents, manure, or samples of the suspicious hay. The important thing is, any detected level of cantharidin is considered significant. It shouldn't be there at all. And of course, the vet will also be thinking about ruling out other things, different types of colic, maybe other toxicities like ionophores.
Okay, so let's say the diagnosis is confirmed or highly suspected. What happens next? What's the treatment? Is there an antidote?
That's the first and most critical point. There is no specific antidote for cantharidin, none. So treatment is entirely supportive. It's all about trying to minimize any more toxin absorption, supporting the horse's vital organs, especially the kidneys and gut, and managing those severe symptoms. And this is absolutely a veterinary emergency. It requires intensive care, usually in a hospital setting. We're talking potentially 3 to 10 days of treatment, sometimes longer.
Not something you can manage at home.
Definitely not.
So what are those immediate first steps a vet takes when that horse arrives at the clinic?
Okay, job one. Remove the source. Get any remaining contaminated hay or feed away from the horse immediately. That sounds obvious, but it's paramount. And call the vet ASAP, obviously. If the horse literally just ate the hay, like within a very short time, the vet might consider decontamination. This could involve carefully giving activated charcoal to try and bind toxins still in the stomach. That's often followed by mineral oil, maybe even repeated doses to act like a laxative and help move everything through the gut faster. You want to limit absorption time. Then, aggressive IV fluids are absolutely non-negotiable. Huge amounts of fluids. This does several things. Rehydrates the horse, helps maintain blood pressure, supports kidney function, which is crucial for flushing out the toxin, and helps correct electrolyte imbalances. Speaking of electrolytes, correcting that severe low calcium and low magnesium is vital. IV calcium gluconate has to be given very slowly, usually while monitoring the heart. IV magnesium sulfate is also given.
Requires careful monitoring then.
Constant monitoring. Blood levels are checked frequently. Sometimes the calcium needs a specific dilution to be given a bit faster if the thumps or tremors are really bad. We also need to protect the gut lining. It's severely irritated. So gastrointestinal protectants like sucralfate, which coats ulcers, and acid reducers like omeprazole or ranitidine are really important. Pain management is a huge challenge because these horses can be incredibly painful. NSAIDs like flunixin are used, but cautiously because of the risk to already stressed kidneys and gut. Often stronger pain relief like opioids or sedatives is needed. And then just general supportive care, maybe a soft, easy-to-digest diet when they start eating again, possibly antibiotics if there's concern about secondary bacterial infections, and just constant vigilant monitoring of vital signs, urine output, blood work. It's complex, intensive care. It requires real expertise. And usually, stall rest for 5 to 10 days afterwards is needed for recovery.
It sounds incredibly intense, a real battle. So given all that, what's the outlook? What's the prognosis for a horse that gets this? And maybe more importantly, how can owners prevent this nightmare scenario?
Yeah, the prognosis, it's always guarded. It really hinges on a few key factors. 1, how much toxin did the horse actually ingest? 2, how severe are the signs, especially is there significant kidney or heart involvement? And 3, maybe most importantly, how quickly and aggressively was treatment started? Generally, if a horse makes it through the first 72 hours, the odds start to improve. But recovery can be long, and there's always the potential for long-term complications, things like chronic kidney problems or even laminitis developing secondary to the systemic stress and illness. So the prognosis really ranges. It can be poor, but with prompt, aggressive care, it can sometimes be good to excellent, which leads right into prevention. How do you stop this from happening?
Yes, please.
Okay, number 1, know your hay source. Buy from reputable suppliers, people who understand the risks of blister beetles, and actually take steps to minimize them in their fields and harvest. Talk to them about their harvesting practices. Ideally, they should cut alfalfa before it fully blooms because blooms attract the beetles. And crucially, try to avoid using those hay conditioners or crimpers that crush everything, including beetles, into the hay. Letting the hay dry in the field for a few days after cutting can also help. Gives any live beetles a chance to move out. And not driving equipment over the cut hay. Weed control matters too, as some weeds attract beetles. In an ideal world, fields would be scouted for beetle swarms before cutting, especially along the edges. And then for you, the horse owner, the final line of defense is hay inspection. You need to visually inspect every bale, maybe even every flake of alfalfa before you feed it, especially if it's from a risky area or later cutting.
But you said they can be hard to see.
They can be very hard, especially if crushed. You might see little dark specks or fragments. But here's the really important part. Even if you don't see any visible beetles, the hay could still be contaminated because the toxin itself is invisible once released.
Right. That's the scary part.
It is. Feeding one flake at a time can help you inspect more closely. And finally, if you're in a high-risk area or just really worried, consider dietary alternatives. Maybe feed more grass hay or look into other forage options instead of relying heavily on alfalfa. And remember that general rule, first cutting and sometimes very late cuttings tend to be safer because they often miss the peak beetle season.
So what does this all boil down to for you, our listener? Well, this deep dive really shows how a tiny beetle, something you might barely notice, can pose just a monumental threat. It turns a staple feed, something we rely on daily, into a potential silent danger for our horses. It's a stark reminder, isn't it, that even in the everyday routines, we have to stay vigilant. So here's something to think about. Given how stable this cantharidin toxin is, and how difficult it can be to spot contamination once it's happened, how might knowing all this change your approach? Not just how you source and check your own horse's feed, but maybe even how you talk about this issue. Could it prompt conversations about advocating for safer farming practices or just raising awareness more broadly in the horse world?